everyone. Welcome to today's episode of the Glow podcast. I have a very exciting guest here with us today, Mandy. And for those of you just joining us for the first time, we are Tailored Marketing and we help businesses with growing their aesthetic clinics and dermatology practices. So if you want to learn more, just drop a comment below or shoot me a DM. And Mandy, I am so excited to have you here today from Hair Oh Yeah, and kind of talk a little bit more about you and your business and how you got started. So if you want to go ahead and give us an introduction, I would love for you to do that.
Fabulous. Thank you for having me today, Taylor.
Of course.
Yes, so I started out in the aesthetic business a while ago, and having lived in Dubai and been exposed to a lot of cutting edge, leading edge things coming out, it was always exciting. During COVID, I was in aesthetics as an office manager at that time, and we had a huge number of patients coming in with hair loss. Obviously COVID related at that stage, but there were also a number of patients who we were seeing on a regular basis for their skin, who we couldn't really help the hair.
Yeah.
What was available didn't really work very well, and we were at a loss as to how to make them look comprehensively better, holistically better. And then along came Alma with a device called the TED, which is an ultrasound device, and I was very curious to find out, did this actually work?
Yeah.
It started the journey, really. It was going along and meeting the dermatologist who'd done the clinical trials for the TED, realizing how it worked, and then starting a practice around that. And I think it has been a process of learning.
Yeah.
To go and do a trichology course, because I quickly identified that that's just a treatment solution. You need to understand what's causing the hair loss. You need to treat the patient holistically. You know, it could be diet, it could be lifestyle, it could be products that they're using on their scalp. The scalp is also skin.
Yeah.
But it's different skin, it's a different pH, it's a different thickness. And how do we look after that in a better way? We aren't taught to do it, really. We're taught to our face, but nobody really speaks to your scalp, and nobody really would criticize you for having a bad scalp.
Yeah, no, I mean, that completely makes sense. So you kind of spoke to it a little bit, but so you started with kind of your journey on discovering more about hair loss and helping people with this during COVID. Is that kind of what got you started? Is you saw a lot of people losing hair from COVID, or was it just during that period with like stress and other things like that?
I think it was a combination. Yes, it was the stress.
Yeah.
It was, and also all of a sudden everybody's in front of a camera.
Yeah.
So it's like, wow, okay, now we're looking at each other pretty close up and analyzing how we look. At that time, I'd also put extensions in. I have naturally very fine hair. It's a bit like cotton candy. I put extensions in thinking, well, I can have long hair, and they all broke off. And they didn't, they broke my hair. And I think I was in a crisis with my own hair, my own scalp, and it was like, how do we remedy this? And there must be a better way to do this. I think that it was born out of a lot of things happening at that time. And unfortunately, post-COVID, we do see a difference in people. If I speak to other trichologists, we're looking at people having androgenic, which is the kind of pattern of balding that we inherit from genes. We're seeing that happening in people 20 years younger than it normally would. We're seeing a lot more scarring alopecia where the bulb is taken out. We're seeing a lot more alopecia areata. Why? There's no real question yet, but I know we're seeing the patterns. So there's a lot more prevalence of hair loss out there, whether it's our diets, whether it's related to COVID, who knows?
Yeah. And what are some of, I guess, the theories behind maybe this hair loss that's happening at earlier stages in life? I know you spoke to COVID as well as stress, diet. Are there any other things that you all are seeing with the patterns kind of that you're detecting, or is this new research?
I think it's all circumspect at the moment. Where people are talking, but we're seeing the trends, but I don't think we have really any answers. And I think even when we have a patient coming in, it's often a combination.
Yeah.
But we are seeing it at ages that we didn't historically see it before. And I think that's noteworthy.
Yes, something for us to look further into, for sure.
I think from the industry perspective, it's exciting because you've got so many more people looking at hair loss, developing products for it, developing solutions for it. Yep. So it does mean as a sufferer from hair loss, we have more opportunities and more ways to treat you.
Yeah, no, that makes sense. And you spoke a little bit too to the machine that you all use, the TED ultrasound. Could you tell us a little bit more about how this treatment works? How many times someone would have to come in for the treatment? How fast it works? How fast people can expect to see results?
Okay. So to begin with, TED is an ultrasound device and it crosses the thick scalp. It stands for Transepidermal Delivery System. So what you're really doing is you're replacing a needle. Traditionally, we've microneedled, we've done PRP with needles, and those cause quite a bit of inflammation. Actually, when they do biopsies of people, they see that 70% of hair loss can be attributed to microinflammation. So when we're needling and we're using numbing creams, we're exacerbating that condition before we start to heal it. The fact that we can now use ultrasound to cross that sound barrier, to cross the thick scalp on the head, that's revolutionary in itself.
Yeah.
How it does is it kind of upsets the fatty layer. So as a patient, what it feels like to you is a massage. You're going to feel comfortable. Most of my patients fall asleep while I'm doing it. And you never go back to needles after that.
Yeah.
And the results, when they've done clinical trials, have shown we're getting 3 times the results of something like microneedling. Unfortunately, there's no comparison with PRP because PRP is not FDA approved, because your PRP versus my PRP would be completely different. There's no way to get a standard measurement. And I think that's very true, that at my age, I certainly don't want my own blood plasma on my head.
Yeah.
But there is value in having something bioidentical. So I think that's where we move to the next part of the treatment. The ultrasound crosses the barrier, but what we deliver is important. And then we go to, are we delivering just an ordinary serum? Are we delivering specific growth factors? Are we delivering exosomes? And is it a combination? And I think that's where somebody like myself comes into play. A bit more experience, it's understanding what we're offering. Traditionally, the TED comes with a serum. The serum is formulated in Italy by a company that specializes in human growth factors. And that's important because it has elements that stop hair shedding. It has elements that combat the inflammation. It has an ingredient that creates new blood vessels to the area, and then it also delivers topical nutrients. So it's kind of comprehensive. Does it have the bioidentical side? No. And that's where I would maybe add something like exosomes. And in terms of exosomes, there are many offers on the table. It's got to do with where it's sourced, if it's a fatty cell or it's a lumbar cell. Exosomes coming from umbilical cords, are they from plant cells? Are they from clean source mammals?
Yeah.
It's a Pandora's box, and stem cells in themselves also very different offerings. I think it's important to note, though, that the industry is moving from sort of injuring people to create inflammation to make you heal, to now offering things like exosomes with platelets that heal and regenerative qualities. So we're looking more, especially as we age or we've been ill, the cells in the skin are not doing what they're supposed to do. So we're looking at how do we regenerate that area? How do we get those cells to be alive again, to have qualities that they don't have? And this is where we're bringing in outside growth factors and exosomes, but also the TED in itself is stimulating that area with the ultrasound. And we add things like low light therapy too, because light therapy is incredible. It's one of those areas that is beginning to get the spotlight that it deserves. But it creates something in the cells called ATP, which is cell energy. And then you get a nice mitochondrial reaction going on, and the cell rejuvenates and kicks off some of that DHT, and everything begins to work a lot better. So yes, there's value in that helmet that you pop on your head, but we'd like to see it tackling a bit more inflammation at a deeper level too.
Yeah, and thank you for explaining that in detail. And I feel like also with obviously the TED, you mentioned that it's important for, aftercare as well, with things like the serums that you mentioned, and then you also mentioned exosomes, which I feel like is something that is kind of new to the industry, or newer, obviously they've been around forever, forever, but we're kind of just discovering a lot of their use cases. So could you speak more to kind of the hopes that we have and some of the research that we have with exosomes and how they can work with helping us restore hair?
I can speak to it a bit. Obviously, I'm not an expert in it. And
That's okay.
company has different offerings. I think it's important to note that yes, they've been around a while. The firms that have been offering them have also discovered how difficult they are. Number one, to reduce them to a size that can be used by the cells. And then in creating them, because obviously they're grown, that you don't lose the markers that you're looking for in those cells. And then how do we transport them to the people who use them without losing the efficacy? And how do we deliver them without destroying the outer shell and again losing the efficacy? So
yeah,
the shape is important. The way that the size is reduced is important. The numbers that you get in each delivery are important. And you'll see some of the big players like Ryan in New York has moved to plated exosomes, which is from the plating, and they've got a shelf-stable product, and their medical division is using it for extraordinary things like injection into hearts and knees instead of surgery. So it's mind-blowing.
Yeah.
In fact, recently this past week, they were showing us slides of the collagen and elastin that the topical products are providing without even being delivered subdermally. You're seeing as much elastin and more collagen than you would get from a CO2 laser treatment. So, I mean, you're talking no downtime, lots of upsides, and maybe no more injectable.
Yeah. The possibilities are endless, right?
And then in my practice, I've actually moved from exosomes to biosomes in a lot of cases. And this is another product from a company called Anti-Age. And the reason they've done it is, again, to create a shelf-stable, FDA-approved product, which has all the markers that you need. So it's copying what we see in the exosomes, but no risk of human DNA and RNA. So it's a little tricky, but I am seeing great results. I'm seeing better results in most of my patients. However, there's some who have more difficult conditions and they can be a little intolerant to the yeast it's grown in. So, you know, it becomes a customized offering.
Yeah.
That we really look at and what we add on at home, how we treat that patient, whether it's a need for a different product, a different routine of delivery.
Yeah. No, and that totally makes sense. And so you mentioned too, with obviously the Almond's Head treatment that you all use, it's kind of like the sound energy. So what are the advantages of using sound energy as compared to more traditional methods that you talked about, like microneedling? Is there less downtime, obviously, I'm assuming, and like just, you know, overall not painful, like you said?
So you're going to come in, the treatment in the same time frame, you're going to get far more area covered because there's less injury. We can treat a whole head quite seamlessly. If you had to needle that whole head, yes, it would be very uncomfortable. You're going to have a numbing cream on. There's then going to be the injury of the needles. And as the body is trying to heal, it's going to bleed, and you're trying to put the serum on at the same time. With the TED, you're opening up the area with the sound. You're then delivering the serum, or you put it on, and then you push it in again with the TED. So you're using air pressure and the frequency that time. And then we can apply exosomes on top of that. But there's no real, yes, there is, how can I say, it is a procedure, so there's still a degree of inflammation, but nothing like bleeding and numbing cream in the way and downtime. There's no downtime. You walk out, you could go straight to a meeting, you could go out with your friends. Those that we ask you don't wash for 24 hours because we want that serum to maximize its potential.
Yeah.
And then with PRP, I mean, PRP is even bigger needles being used. They do add some serums to the PRP nowadays, but when you're injecting PRP, it's painful. It's very painful from a needle perspective, but also the pH of the delivery can make it burny.
Yeah.
Your own plasma can be good, but even my young patients report to me that they've had no efficacy from PRP. So it's one of those things, you might have a result, you might not.
Yeah.
I'm not saying it's out of the ballpark. Some people have very good results, but it is a lot more painful. So from the TED perspective, no downtime, no needles is huge for people.
Yeah, for sure. Because I feel like needles can be very intimidating. Even if you're like, even if people tell you like, oh, it's not super painful, it's still like you have a needle going into your head. Like that's very intimidating for sure.
And then you'll have the apprehension before the next treatment, and then the
Yeah.
body does get inflamed. So how much hair are you losing to inflammation every time you have a procedure?
Yeah, and that's definitely something to consider as well. And with the TED too, what do results kind of look like? I know they vary, I'm sure, on an individual case basis, but what do they, I guess, could you share with us one of like your success stories with a patient where they've had a really, really good result with the TED?
Fortunately, I have many of those.
Yeah.
I think the standard is to know is that immediately after one treatment, what you can expect is shedding to stop, which is quite unheard of with a hair loss treatment, because most of them will have a period of shedding before you grow hair. And I've had literally a patient where as I was touching his scalp, the hair was falling out in my hands,
Yeah.
But the next treatment, we lost only one hair, and it stopped within a week after the first 10 treatments. And then when you stop that shedding, you can begin to heal. But the other thing is obviously your scalp receives nutrients straight away, so your existing hair begins to grow, which is quite exciting. And because even with the biosomes that it has a bit of caffeine in, which acts a bit like minoxidil to open up follicles, some of the hair that was about to go into the growth cycle will be pushed in. So that first month is quite exciting because you see a result almost immediately. And then we have a little bit of a lull between the next couple of treatments, because the hairs that we really want to grow need the follicle to be restored, and that's what we're really doing. All those nutrients are going to restore the health of the follicle, and then that hair comes up and we begin to see stubble at the second or third treatment, and then the new hairs come up. So it's a long process.
Yeah.
Treatments, the protocol is 3 in a row, and often I'll do 4 or touch up at 5.
Okay.
But I think the most exciting for me is the results that we are having with patients who shouldn't get hair.
Yeah.
And at the moment, she's 8 years post-cancer. And when we speak about hair loss, normally when you hit the 4 to 5 year mark of not having a hair in a certain area, the follicle's dead. It's dormant for a certain amount of time, and then it's considered dead. And the chances of you actually restoring that hair is very low.
Yeah.
So a patient like that she had a whole band of hair, almost like a headband around her face that was almost gone.
Yeah.
And that hair's all growing now.
Wow.
A patient who was going to UW Medical for an injection every month for scarring alopecia, and she's well into her 70s, and we've managed, she comes more regularly because she has a scarring alopecia, but she cut bangs last month. It's the first time she's been able to cut hairstyles, and the hair's body's back. We've managed to get some eyebrows back, eyelashes. It's giving hope where people had no hope before, where dermatologists would just say that's, you've got this condition, live with it.
Yeah, no, for sure. And I mean, I feel like that must be a really rewarding thing for you too, for you to be helping these patients who before, like you said, felt like they had no hope. So can you kind of tell us how that feels from your perspective to see these patients accomplishing things that, they didn't think they would be able to?
I think it's very difficult to put a value on that kind of restoration, because it restores esteem, self-esteem, to go out there in the world today, to go in front of a camera, to be confident in front of your partner again. And it sounds like nothing, but people in the aesthetic practice, I think when we're marketing, the companies will go, oh, we're going to make you look better, we're going to make you look wonderful, we're going to grow you thick hair. And that's great. I mean, there are people who want that, but a lot of my patients are not that. They walk in with a hat on or a beanie on, and they take it off and they're in big trouble. So there's a bigger job to be done. It's not purely to look good for an Instagram post.
No. Definitely not. It's more of, like you said, restoring that self-esteem and restoring that confidence. And, when you feel good like that, it sometimes it is because you look good, but it's also, it's about feeling good. You want to look good so you can feel good.
And I think that's kind of, we say we partner with you on your hair restoration journey, because it's a journey. It takes time, it
Yeah.
takes effort, it's a lot about consistency. You know, you might need to use a serum at home in between treatments. You might need to get a bit of red light therapy to get the inflammation under control. You might need to add a vitamin D to your diet. You know, there are all sorts of things that we look at, and we try to really work with our patients to get the best result we can for them.
Yeah, no, I love that. And I feel like it is a journey, like you said, for sure. And are there any other things that you recommend besides obviously like the red light? You said diet as well. Is there anything else that you recommend to your patients while they are on their hair restoration journey?
I think it's very important, if I go back to the beginning, is to understand the scalp. And the scalp's pH is different to the skin. And we're not used to looking after our scalp. You know, patients will go, oh, I've got a scrub for my face, I'll just use it on my scalp. And I'm like, no, please don't do that. Oh, I'll just use baby shampoo, it's fine. I'm like, no, please don't do that either. It's a bit about educating and beginning. I think a lot of my patients go through this journey where it's like, oh, you know, I need to watch my scalp. I need to take care of it. I need to, you know, get all the product off it. I need to use the right shampoo for it and not color it with too many harmful things if it's affecting me. You know, and most people can go quite happily along, but every now and then we hit a blip, and then you kind of have to step back and take care before you can move forward again. I think it's also, and the hair is often the result of what's going on inside. And that's part of the bigger journey. It's like, okay, yeah, I do have stress in my life, and I am seeing it manifest with hair loss. And, you know, I can get it back for people, but you could lose it again, especially my autoimmune patients. If they hit big stresses, they can lose that hair that we've grown for them. And it can be a lifestyle change. Yeah. It's tricky. There are a lot of things, and we're still learning. That's the exciting part about it. We're learning about the influence of the gut on the hair, and especially now we have GLP-1 drugs. That's the new hair loss. Companies are actually advising doctors to provide hair loss solutions at the same time they prescribe the drugs. And the reason is, you know, hair is a non-essential function. So if your body needs nutrients, it's going to the organs first, and the hair will get it last. So you need to actually be consistent with your intake of protein and observe what's happening to your hair, and really treat it at the same time if you can.
Yeah, no, that makes sense. I mean, our hair is a part of our skin, and I feel like a lot of times people forget that your skin is an organ, and it's one of the biggest organs in your body too. So of course, if, you know, your skin is suffering, then of course your hair is going to suffer as well. And like you said, it's considered something that's non-essential, so it's going to be the last thing to get that nutrients. So if there's anything in your lifestyle that's not doing well, then, you know, your hair might be the first thing to kind of feel that.
Yes, exactly.
Yeah.
It's exactly that. It's the canary in the gold mine.
Yeah, no, I mean, that completely makes sense, and I feel like that's a really, really good way to explain it too. Also, this is another question too. So I know you mentioned that the TED right now is kind of, like you mentioned that your patients will sometimes go to the dermatologist and they will say, you know, there's not really much we can do. So how prevalent right now is the TED in the dermatological community as well as the hair restoration community? Like, is it easy to find that in your area, or is it pretty niche right now and only certain people are offering it?
It's produced in Israel, made in Israel, and it's been sold through Alma Lasers worldwide. And in Europe, it's actually been used for 12 years and more. And there they use it for face, for arthritis, for injuries, because you can cover a big area and deliver drugs. You can even use it for immunizations, it's crossing the barrier. In the States, it's only FDA approved for hair loss and hair restoration. It is around, and you can even look on the Alma website for one in your area. It'll give you a list of providers. What you do find is that a lot of practices are battling normal medical practices. Dentists, naturopaths, chiropractors are battling to survive with medical insurance.
Yeah.
And they're bringing in devices, and the TED is quite an easy one. So they bring in the TED and they offer the service, but they really have no expertise in hair at all.
Yeah.
That's, I mean, I know I started there. I was like, I know what I'm doing. And you're like, this is a little bit more difficult because we need to understand hair loss and what's causing it to be able to treat a person. So yes, I think that's important when you do find somebody offering the service. The service in itself works, but it might not be the whole treatment you need.
Yeah.
It would be good to find somebody who is either a dermatologist or a trichologist.
Yeah. No, that makes sense. You need someone who understands it because, like you said, it's not just using the machine. It's also the things in between treatments. It's the certain lifestyle changes, and you really need an expert kind of in these different things to walk you through the journey. So that completely makes sense.
I'll give you an example. I had a lady come in yesterday. It was her second treatment, but she'd had a big gap between the two, and she had areas that looked like her skin had burnt and it was fresh skin growing. And I'm like, well, what's going on? So it's like I had this whole treatment plan for her, and you have to, okay, that's not going to work today. We need to heal you first.
Yeah.
Before we treat any more hair loss per se. Hopefully that we heal the scalp and then we can go forward from there.
Yeah, no, that makes sense. And somebody else who maybe hasn't seen that before, or they're not as experienced with the machine, or, they're not a trichologist, they may have just continued on with the treatment in the same way.
I think that's the issue. Sometimes you only have what's in your box. And I think dermatologists are restricted by that often too. They've got a 15-minute consult and they have a prescription pad. And they're going to give you minoxidil, finasteride, spironolactone, dutasteride. See you. Carry on. Yeah. It's also, again, a part of a solution.
Yeah, no, I completely understand what you're saying. And so what advice would you give someone who is going through kind of either their hair restoration journey or they're maybe just starting, what's some advice that would be useful? Because obviously you've seen a lot of people going through this.
I think right at the beginning is to kind of start watching what's happening with your hair. How much are you losing per day? Are you losing it when you wash it? Are you seeing it all over the place? Is it more than normal? And then I ask people like, what is the condition of your scalp? And it's a question we don't ask people, and they haven't really thought about it. Do you have dandruff? Does it get itchy? There are all these kind of questions you can begin to ask yourself, and then look at your diet too, because there's certain vitamins that your body and your hair respond to quite quickly, and you can just easily add some of those and maybe get some blood work for certain things that you don't know. But that's a beginning point. All over Instagram there are so many remedies, and it's not to say that they don't work. It's just the scalp is very thick. If you keep layering sebum on all these solutions, you can cause other conditions. Something like seborrheic dermatitis will respond to an oil and it'll go ballistic, and then you'll have a huge problem.
Yeah.
When you're doctoring at home, it can be used. I think that's why you see this doesn't work, this doesn't work, this is a hoax, because it might not fit what's going on with you.
Yeah.
Find somebody in your area who can help if you're in trouble, but get your gut clean, some probiotics.
Yeah.
Make sure you're getting enough protein. Those are basics. And make sure that you're washing your scalp properly to get all that product you're putting on off.
Yeah, no, that makes sense. And you mentioned some vitamins too that could be kind of like help a lot, or help a little bit in any way. What vitamins would you recommend?
Okay, for most people where we live in Pacific Northwest, we need a bit of vitamin D. But it's kind of a tricky one. If you have too much, it can cause another problem. Vitamin B is obviously part of what helps hair grow. Another big one is your ferritin, your iron levels. If your iron levels are too low, you're not going to grow hair. And that's a tricky one because doctors are not normally too concerned if you've got low iron levels. Things like zinc is a tricky one. You don't normally think of that. And then we have certain supplementary things, like at my age, collagen becomes an issue.
Mm-hmm.
Protein intake is a huge part of hair growth. Your body is going to use about 20% of your available protein to grow hair, so you need to make sure you've got enough going in, and if not, the collagen also needs to hold the hair in. So as we age, that hair loss can be just from a lack of collagen holding the hair in. they're simple things, but they can make a huge difference. And I'll often have people coming in and saying they need a treatment, and really all they need is nutrition.
Yeah. No, it is. It's kind of crazy how much just like a change in like your diet, or like you said, protein intake. I feel like protein is so important for just about everything in our bodies. So that's like one of the first things I feel like for just about any issue you're having, that you're like, okay, I can look at this.
Yeah. And then again, are you absorbing it? Do you have gut issues? Because skin, a lot of scalp issues are skin issues. That gut health is of optimum. If you've got a rough patch on your scalp, that hair doesn't grow until that scalp condition is healed.
And I would just love for you to tell my listeners where they can find more information on you, more information on your business, and all of those fun things. I'll also include it in the show notes for easy access for everyone, but I would love for you to tell them too.
So my business is in Bellevue, Washington, and the easiest way is to go onto the website, which is www.heroyear.com. And then we also have quite a big following on Instagram, and that's at @WowHeroYear. LinkedIn, we're on Facebook, but I think anybody out of the area looking for TED treatments, the best way would be to go on to the US Ulma site.
Okay.
They would have a list of providers in your area. And if you're not specifically looking for TED, another source could be the International Association of Trichology. Because you find a trichologist who might have different ways of dealing with your hair loss that might be better suited to where you are and what you want to do. And I think most of us offer, well, I certainly do offer a free consult, because it's important that you understand if this is something that is going to work for you, and I need to see if you really need a treatment or if you just need nutrition or treatments.
Yeah, no, that's great. Awesome. Yeah, I'll link everything below, and I really, really appreciate you for coming on the podcast. I feel like this was so informative, and you explained everything so well, so I really, really appreciate you, Mandy.
Well, thank you, Taylor. Thank you for the opportunity.
Yeah, of course.